Hi, everyone. Thanks for joining me today. If you've ever felt like your initial assessments felt a bit too robotic or checklist driven, this video is for you. Initial assessments are crucial in therapy. They help us gather the information we need, and they can also be a chance to start building trust and rapport with our client. Sometimes, though, they can feel more like a medical questionnaire than a conversation. Today, I'll share tips for making your initial assessments feel warm, human, and focused on connection while still covering everything that you need clinically. For many of us, initial assessments start with running through a checklist. Have you ever experienced X? What about Y? There's a lot of information that we need to gather to make sure that we understand the client's needs and goals for therapy. And often these first sessions start the conversation about possible diagnosis. While there's nothing inherently wrong with using the session for the goal of data collection, it can feel clinical and detached to the client. While some therapists might prefer sticking closely to a structured checklist, there's room to adapt this to your style and the client's needs. What works for one may not work for another. When a therapist rattles off questions like a list, the session might feel like a doctor's appointment instead of a safe space for connection, and that can set the wrong tone for therapy. And sometimes it's difficult to bounce back from that, especially if the client is new to therapy. They might start believing that therapy is all about you being the expert, knowing all the right questions to ask, and making recommendations or giving advice. So if you're feeling like you might want to play with your assessments and make them a bit more personal, a bit more individualized, and feeling more therapeutic in nature, I've got a bunch of ideas today. And just to be clear, the goal isn't to ditch the checklist completely. All the stuff that you're used to asking is still important, and that doesn't change. The goal is to weave those questions into a conversation that helps the clients feel heard and supported. So let's start at the very beginning and create a roadmap for your first session with the client. Do you remember walking into your counselor's office the first time? What was it like? Sometimes I like to pretend that I've never seen my office before and walk into it as if I were the client. Where do their eyes go? Is there too much clutter, not enough cozy or inviting places to sit? See if you can go to your office now, either in your mind or physically, and look around with fresh eyes. Is there anything that you can do to make the space more inviting? Pay attention to lighting, natural light, or warm lamps can make a really big difference. And consider any scents or sounds in the space too, as they can subtly affect clients' comfort. Clients often feel uneasy during their first session for a million reasons. Trying to make sure that the space you're inviting them into isn't one of the things that makes them uneasy if it's something we do have control over. Some clients might prefer a more structured approach, especially if they're feeling overwhelmed by open ended questions. Adapting to the client style shows responsiveness and builds trust. So, starting the session, you know the old game of who talks first. I personally like to ease this by giving them a brief outline of what to expect. So, we'll spend some time talking about what brought you here today and your goals for therapy, and then we'll zoom out to learn a little bit more about you as a person, including your values, your experiences, your strengths. And towards the end, I'll suggest a couple of potential directions that we can take moving forward. Is there anything else you want to make sure that we cover today? And your presence matters too. Take a moment before the session to ground yourself and approach the client with warmth and openness. Your energy could influence how safe they feel. And let them know up front. I might be asking a few clarifying questions as we talk just to get the full picture. And if there's anything you're not comfortable answering yet, that's okay too. We can skip it, or you can tell me you just don't want to talk about it, and maybe we'll come back to it later today or in the future. You are the one in control here. And it's also helpful to be aware of cultural factors that might influence how a client approaches therapy or their comfort level with certain topics. Taking a moment to ask about their cultural or personal values can set a collaborative tone and show respect for their lived experience. For example, in some cultures, discussing mental health openly might feel taboo. Asking about values or beliefs rather than jumping straight to diagnostic questions can help clients feel more comfortable. And the idea here is really to set a collaborative tone to the therapeutic process. Whether you're working in private practice, a community agency, or a hospital, think about how you can tailor the flow to match your environment while staying client centered. Providing a roadmap not only helps set expectations, but also gives the client a sense of control and structure, which can help reduce anxiety. So think of the checklist as a guide rather than a script. Focus on the items most relevant to the client's presenting concerns and revisit others as the therapeutic relationship develops. We want to make sure that we're keeping the client's story central. So instead of leading with questions like, do you have a family history of depression? You might use your reflective listening skills and say something like, you mentioned that things have been getting difficult lately. Can you tell me a little bit more of what's been going on for you? And this might feel like a very natural place to assess for suicide and social supports too. Look for organic opportunities to weave your regular initial assessment questions into the conversation. And this might be easier once you're familiar with those questions and what the point is of asking them. You might want to pause here and review your initial assessment questions. What is on your checklist of things that you need to know? And depending on the setting that you work, a checklist might change quite a bit depending on funding and payers, population, setting. I know the agency that I work in, there's a lot of questions there because for drug and alcohol counseling, our county wants us to pull a lot of initial data in those assessments to help track trends. We look at things like hepatitis C, HIV status, and risk, tuberculosis, past treatment episodes, levels of care, and we always assess for suicidality. We also dig into family of origin and educational background. And while all of those things can be important to the overall story, the clients don't always see the connection in the first session. I know some people in private practice who just do the adult attachment interview protocol as their initial assessment, which can you imagine? It could just be a lot. And if you're following that protocol, it's not flexible or conversational. So I really don't think that there's a right or wrong here about how you want to do your assessments. I just really think it's about you having intention behind why you're doing what you're doing. And if you can clinically justify it, go for it. If your setting has an extensive checklist, consider which items are non negotiable for the first session versus those that you could explore later. Prioritizing helps keep the session manageable for both you and the client. And be mindful that certain questions, like those about family dynamics or medical history, might require extra sensitivity based on cultural context. Adjust your language to show respect for the client's lived experience. But back to my original idea about knowing what's on your checklist of questions and being more conversational with it. So we've got this hypothetical client that's coming in complaining of depression. If they share about stress at work, you can ask, how's your sleep been during all of this? Or do you notice this stress impacting your relationships or daily routines? These questions naturally bring the checklist items in without derailing the client's story. If a checklist item feels forced or out of place, it's okay to leave it for later or reframe it in a way that feels more relevant to the conversation. And if some of your checklist items don't come up organically, save a few minutes at the end to run through them. You could keep them on a clipboard on your lap and refer back in the last 5 to 10 minutes. By then, you've built enough rapport that clients are usually more comfortable at that point with straightforward questions. So, we want to focus on balancing rapport and clinical needs. We're going to make sure that we're not playing the role of data collectors in a research study, but rather we want to validate and empathize throughout the session. When a client shares something vulnerable, take a moment to acknowledge it. That sounds like it's been really challenging for you. Thank you for sharing that with me. Show them that you're listening and that you care about their experience. Remember to pace the session thoughtfully. Allow for pauses of silence or reflection, as these moments often bring out deeper insights. And while we gather information, it's also important to notice and reflect on the client's strengths. For example, if a client shares a story about overcoming challenges in the past, you might say something like, it sounds like you've shown a lot of resilience in tough situations. This not only builds rapport, but also helps the client feel seen for their capabilities, not just their struggles. If you do need to switch topics, do so gently. This has been really helpful to hear. I'd like to ask you a bit about your family history next. Does that sound okay? And when addressing heavy topics like self harm or trauma, it's important to normalize the experience while remaining compassionate. Prefacing your questions can help clients feel more comfortable. Like sometimes when people are going through a lot, they might have thoughts about whether life is worth living. Have you ever felt this way? This phrasing gently opens the door to a serious conversation without overwhelming the client. If the client has already shared a history filled with hardship, it's important to approach gently and with empathy. Preface these moments with understanding. You've shared a lot of difficult experiences with me, and I really appreciate your openness. Sometimes with a story like yours, people can have moments where they feel overwhelmed. Has this been the case for you? For clients with a less complex or situational issue, the tone can be a lot lighter but still respectful. There's a few questions that I just like to ask everyone. They might sound a bit clinical, but they help me get the full picture. Trauma-informed care is another important framework to keep in mind. This means approaching sensitive topics with an understanding of how trauma might affect the client's ability to engage and ensuring that your questions feel safe and non-intrusive. Trauma-informed care means paying attention to your language and pacing, ensuring that your questions don't feel abrupt or invasive. For example, instead of asking directly about past traumas, you might say, sometimes people have gone through difficult experiences that are hard to talk about. If that's the case for you, we can go at your pace. And this brings us to a Gestalt concept called confluence, which refers to the blending or merging of boundaries between self and others. In therapy, this often shows up in how we unconsciously match our tone or emotional state to that of the client. Matching a client's tone can foster connection, but it's also important to remain aware of when that blending might become unhelpful. For example, if a client is dismissive or minimizing about something serious, perhaps laughing off some thoughts about self harm, it's crucial not to merge with that response. Instead, gently bring attention to the disconnect. I notice that this is something that you're laughing about, but it feels like it might be something really significant. Can we explore that together? Confluence can also occur when therapists try too hard to match a client's energy, potentially leading to an overly casual or even overly serious tone that doesn't align with the context. For example, if a client responds in a way that feels incongruent, laughing during a moment of vulnerability or using humor to deflect, it's essential to gently bring that awareness to that dynamic without judgment. So you might say something like, it seems like this is something that you might be feeling uncomfortable talking about, and that's okay. I just want to make sure that we're giving it the space that it deserves. And if you notice yourself mirroring a client's dismissive tone about something serious, pause and ground yourself. You could say, I notice we're moving through this quickly. Do you feel like there's more to unpack here? This gently shifts the tone while giving the client space to reflect. Pay attention to your own emotional state during the session. If you notice yourself feeling overly aligned with the client's mood, whether that's sadness, frustration, or dismissal, it's a good moment to pause and ground yourself. A simple internal check in like, is this my feeling or theirs? Can help you recalibrate. By being aware of confluence, we can avoid misattuning to the client's needs. Staying grounded helps ensure that we're responding to the client authentically rather than mirroring defenses like humor or avoidance. And this builds trust and helps keep the focus on their growth. By the end of the session, you've probably gathered a lot of information about your client and hopefully started to build some trust and rapport. We want to make sure that we're revisiting their hopes and goals for therapy, maybe in the short term, maybe in the long term. I've certainly had clients where their short term goal was just to create a long term goal for therapy. So near the end of session, I'll say something like, now that we've talked more about your history, do you have a clearer sense of what you're hoping to get out of therapy? Often clients articulate their goals more specifically at this point. It's also worth noting that goals can shift as therapy progresses. What feels important now might change as we explore deeper layers together. Then it's generally a good time to introduce what the next steps could look like. I like to summarize what I've heard and offer one or two possible directions for therapy. So, based on what you've shared, we could start by focusing on this specific goal or this alternative approach. Does that sound like it aligns with what you're looking for? Concluding the session, we just want to recap the main points and ask for any additional information. I like to ask my clients if there's anything else that feels like it would be important for me to know. Because no matter how thorough my checklist is, there's usually something that it misses. And at the end of the session, now's the time to talk about scheduling, session frequency, or maybe if you don't think you'll be a good fit, exploring referrals together. And as we wrap up, I like to reassure clients that therapy is a process that we'll navigate together. I might say something like, therapy isn't a one size fits all approach. And as we get to know each other, we'll figure out what works best for you. After the session, take a moment to reflect. Did you miss anything important? Was there a topic that the client seemed hesitant to dive into? These reflections can guide your approach for the next session. And we've talked about ways to make the initial assessments feel more like a conversation, starting with a clear roadmap, weaving in checklists naturally, and handling sensitive topics with care. Remember, making assessments conversational is a skill that grows as you practice. Be patient with yourself as you experiment and find what feels authentic to you. And as you try these tips, start small. Pick one or two changes that you can make in your next initial assessment and see how it feels for you and your client. Thanks for tuning in. If you have any other strategies or tips for making assessments conversational, I'd love to hear them in the comments. Till next time, take care.